Welcome to Family Medicine in 5. Today we're going to talk about eyeballs and trauma to the eye. So a few things that can happen to your eyes. You can get a foreign body in your eye, and that can cause what we call a corneal abrasion. Know that the cornea is the top covering over top of the eye. It refracts the light so we can see better, and you can scrape that. The number one thing that we see in family practice is scratches with foreign bodies, like maybe a leaf or a fingernail. Someone's cleaning the garage up top and they get a bunch of stuff in their eye and it actually scratches the eye. Sometimes you'll get chemicals in your eye. I've had patients where they were using like an essential oil cream up top and some of the fumes got in their eye, and so we had to irrigate it out. There's all sorts of things that can bother the eye. And then there's infection as well that sometimes feels like you have a foreign body in there. The cornea is very thin. The cornea is about 1/2 millimeter thick, which is actually like 5 pieces of paper on top, or the half of the size of a credit card. And the cornea heals very quickly. It only takes 2 or 3 days for an abrasion to actually improve. So we're going to show you today how we diagnose a corneal abrasion, and we're going to show you how we irrigate an eye with something called a Morgan's lens if you actually get something in your eye that we have to flush it all the way out. Okay, let's go. These are the supplies that we'll need. Before we examine an eye, we want to numb it up, and we're going to use something called proparacaine, which is just a liquid drop. After that's numb, I want to put a little bit of vegetable dye in, which is called fluorescein, and if there is an abrasion in the eye, that fluorescein is going to light up underneath a Woods lamp, which is just a special UV light. If I see a foreign body in there, often I take a needle and just flick it out, or you can even use a burr to burr it out. If I want to irrigate the eye, I often use something called a Morgan lens, which is attached to an IV bag, and it's irrigated. That's what we're going to show you today. This patient presented to clinic with a right painful swollen eye. Not much discharge, but it was really painful, and so we numbed her up, and then we used some fluorescein to light it up. That's the vegetable dye. You just get it wet and sweep it across the lid. And then use the Woods lamp to light it up. And what we're doing is looking for some take-up across the top of the eye. The fluorescein actually gathers around the edges, but we're actually looking to see if there's any scratches across the top. There's some still pictures to see a little bit better if we can see any scrapes, and we didn't. So then we flip the eyelid. We want to look underneath and see if there is a foreign body under there that's continuing to scrape the top of the cornea. This is uncomfortable for the patient, so make sure that you are good and numb before you attempt it. I didn't see anything on this exam either, so we decided to irrigate it. We used the Morgan lens, which is just a big contact. You slip it below the eyeball first, and then into the top is the easiest way to get it in. The whole thing is hooked to a whole IV bag. I use a liter of fluid. When I do this, I often have the patients lean over a bucket like this, hold onto the tubing so it doesn't pull on them, and then you just flush it. You want to use the gravity like we've talked about before with IVs, so it's not putting a lot of pressure on the eye, but it just irrigates it out, and it actually is very soothing for the eye once we get all that foreign body out. It's a lot of fluid going in, but it takes only about 15 minutes for it to completely flush. So you can see that the water's just dripping down her face into the emesis basin. So you want to make sure that the patient is as comfortable as possible during this process. After the irrigation, we pulled the Morgan lens, and all of the fluid was down in the emesis basin instead of soaking the patient, so it works out great. I also prescribed her a erythromycin and antibiotic ointment to make sure that it healed up okay. This is my favorite meme about eyes and moms. You'll love it. Those eyes in the back of our head. Anyway, thanks for watching. I hope you learned something.